Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Ranch Podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. I appreciate all the love and support. Gracias a todos por su apoyo. Continue to tap in on the podcast, however you listen to the podcast, and of course, rate, like, share podcast episodes, and of course, hit that red subscribe button on the YouTube. Um, Happy Social Work Month. It's still Social Work Month. To all the ladies, happy Women's Month. Um, and it's been a busy month. Social working and things. So recently got back from Albany, presenting, and then by the time this recording airs, I'll be in Brooklyn for a social work kickback event, a self-care event to give back to fellow social workers. Uh, Officially, the is sold out, so where it comes through. Looking forward to meet uh, talented, amazing social workers and the importance of connection and networking. And this is how I met this talented social worker out in Virginia, Amanda Whitlow. We met at the recent Millennial Social Work Conference. How you doing today?
I'm good. How are you?
Doing great, doing great, doing great. Before we get started, I definitely want to do the disclaimer since I always forget to do the disclaimer, especially on the video side. This podcast is not intended to be a replacement for individual therapy or counseling or any of that stuff. If you are not okay, please call 988. Please call 911. If you have a therapist, call your therapist. If you have a psychiatrist, call your psychiatrist. It's okay not to be okay, but get the help that you need. And for my international viewers and listeners of the podcast, whoever or whatever is your emergency line, whether it's 911 or any other number, emergency line, to reach out if you need assistance. So, um, like I said, the importance of networking and collaboration and been very intentional especially the last 3.5 years. Um, Actually, the full 4 years, being intentional using the podcast as a networking tool to meet social workers to find out what is happening in our communities that we're not going to hear on the news or local news or even the national news. So, Amanda, how are things going?
Things are going, always busy for sure. Life of a social worker never really comes to an end or a pause, but I guess we fit a little bit of break in there along the way. But nevertheless, always busy, always in need, but blessed to be able to be a social worker and, help.
Absolutely. For those who don't know who you are and what you do in our wonderful, interesting field of social work, let the people know what you do.
Yeah, so my name's Amanda Whitlow. I'm a licensed clinical social worker. I am practicing in Virginia. I'm licensed in Virginia at this time. Hopefully, we'll be expanding that license, but right now, we're in Virginia. I own my own private practice, which just launched officially the tip of this year. So that is called Concrete Roses Counseling and Consulting. And that is a dedication to my late mother, Rosemary Cottoms. So, very, very excited about that. But in addition to Concrete Roses, I do a lot. I'm an adjunct professor at Virginia State University. I'm currently teaching Intro to Social Work for the Bachelor's of Social Work program. I have been doing adjunct for 4 years now, and it's been amazing. Virginia State is my alma mater as well, so always good to go back home and pour into the next generation of social workers. And full time, I work as a mental health support specialist for Chesterfield County Public Schools, where we really set out to link and bridge the gap between mental health and education. We are linking families to mental health supports. We oversee the threat assessment process and train over 67 threat assessment teams within 67 different schools on carrying out the threat assessment process, linking children and families to resources, connecting and throw in preventative things like resource fairs. And then on the tail end of that, we do also have to respond to critical incidents. So, unfortunately, when students or a staff member dies at a school, we do also provide support there to receive the students who might be grieving and taking it hard. So, lots of different things. Definitely have my feet and hands in a lot of different areas, but nevertheless, go social workers.
No, for real, we always tend to, I guess, by not really by choice, because things are so expensive, and we always got to be dibbling and dabbling and find multiple ways, multiple streams of income just to pretty much like live our lives day in day out. And we got families or whatever, and that the cost is never ending. Is capitalism is running amok, unfortunately.
Who you telling? Yes, definitely always have to have, multiple streams of income. That's one thing that I've learned. And, it doesn't hurt. It's actually, really good. And I feel like that's what helps me not burn out of the field, being able to do so many different types of social work and things like that, so that I'm not just flooded by one area of the field. So it comes with it's good and it's stress, but at the same time, like overall, I'm just thankful, to be able to have touched as many places and experienced as much as I have in the field so far.
How long have you been in the field?
I have been in the field since 2015. So I graduated with my bachelor's in 2015. So after that, I went on to do some residential work with children in a residential facility. Then I quickly realized that was not for me. Those kids could fight like worse than girls and bad girls club. So I was like, not right now. And so then I slid over and started doing intensive in-home is what it's called here in Virginia. And that looks like just providing counseling up to 10 hours a week for children and families at risk of out-of-home placement. And so I did that for a few years. And then after that, I did like case management stuff and everything else that I told you in the beginning that I'm currently doing. So,
Okay,
yeah, lots of experience.
gotcha. No, that's good. That you realize, okay, you did something, and I always tell people that just how do I, what type of job can I get? Like just start something, and as many things that you could do, and you realize very quickly, okay, I don't want to do this, and so you eliminate stuff you don't want to do, and then until you find something, you find a population that you like to do and want to serve, and sometimes um, populations, I want to do this and work with this population, and it might not be for you, it might not be like what you thought it was going to be. So definitely.
100 100%. I always tell people never let a job burn you out of your career. You worked hard for this degree. Remember your why. Like, just because a job might not be for you, I always say, like, move on to the next one. This field is so like diverse, and that's the beauty of social work in itself. Like, you can work with so many different populations, and social workers are just all over. So I always say, never let a job burn you out of your career. If that job is not for you, then move on to the next. But, don't burn bridges, but if something's not for you, it's okay to move forward.
No, absolutely regarding that. And a perfect example of different ways how we're so diverse was like I said at the beginning, how we met at the Millennial Social Work Conference and the different you know topics that were raised and ways to make income or different ways we could use our transferable skills in social work and all the diverse vendors that were there. So it was definitely great to see like people are really be intentional about ways to make income and different ways that we actually can make money with our social work degree.
Yes, for sure. That was my first Millennial Social Work Conference, and I don't think I've stopped talking about it since I got back. It was like the best conference I've ever gone to be surrounded by social workers, and other people in the field, but still the diversity in the room. It was just amazing. And like you said, all the different topics, we had to choose from for breakout sessions. It was like an experience of a lifetime. I'm already recruiting people from Richmond to come with me next year. Like, come on, y'all, let's get an Airbnb or something, but y'all have to go. So it was that conference was like that.
No, it definitely was. It was my first time also, and I had a blast. Presenting at the conference and just seeing people I met or see people you follow online and then see them in person for the first time, or might have seen them again, or had past podcast guests and finally meeting them in person, and so it was definitely a lot of fun.
Yes, it was funny. Kim and I, when they were doing their keynote on the first day when they were
Yes.
speaking to us, it was funny because like she's from Richmond, she lives in
Right.
Richmond, and so being able to say like, oh, this area, or laugh about it when she's telling, certain stories or experiences and knowing exactly what she was talking about was just the kicker for me. So it was I can't wait for next year. Just know that.
Yeah, I
Signing
definitely.
up for the early bird ticket next year.
Yeah, I definitely want to go back next year. It's definitely is even when like you Google social work conferences like the beginning of the year, that was like one of the top that like pop up. So shout out
Oh,
to
wow.
Erica and her team for an amazing job. I know that was not easy coordinating the conference, and Atlanta is such a hot spot in terms of a lot of different things. So yeah, we had a blast.
Yes, we did. Shout out to Erica and the whole entire team, everybody who, just played a part in making it come together. I literally found out about the conference through one of the Facebook groups I'm in, it's Clinicians of Color.
Okay, I've heard
Um,
of it.
So yeah, I found out about somebody posted what conferences are out there. I need my CEUs, and
Mhm.
so people started posting, and I came across that, and I was like, I need to be there. So
Yeah, yeah, I met Erica like 3 years ago. She actually came to New York um,
Mhm.
for a Joy. Uh, she did like a barbecue, and Erica came up and she was talking about the Millennial Conference, and okay, I need to go. It's on my list to go. So I finally was able to go. So yeah, I recommend anybody. You ain't got to be a millennial. Just go, enjoy yourself, have a blast. Um, it's definitely one of the top social conferences to go to. And shout out to Dr. E Street, taking time out of his busy schedule to talk and have a candid conversation on what, well, as candid as he can be. So
Right, right, right. He tried.
he can't get in trouble, but
They was ready for his question to question him though. So
yes, absolutely. Shout out to him for making the time to come through and answering questions and that we have. And there's a lot that's happening in social work regarding title protection and the interstate compact. Recently, I think Utah just officially signed on board for that. So there's a lot happening in social work that affects us. And and even states continuing to abolish at least the LMSW version of the licensing test, or they're trying to abolish that one. So yeah, so a lot of good topics that was happening.
Yes, indeed. Yes, indeed.
So what? So kind of like a two-part question for you. What are you seeing in the 9 to 5 that will affect, you know, working with kids and families, and then also what are you seeing in your private practice in terms of
So
issues?
I'm sorry.
In terms of issues, what do you like? What are you seeing?
So for me, I see just the gap. The stigma is still there. I know as a society and then as people in the field, a lot of times um we're exposed to mental health all day. And so
Yeah.
sometimes it can seem like, oh, we're getting somewhere. And then you step out into just the regular world, or you're working with the average family or the average student, and you still realize like there's a stigma behind mental health, there's a stigma about getting help, there's fear there, and sometimes fear can make you freeze instead of fight. And so with that, it's a lot of just hesitation or shame with getting the students help, but also on the other end of that, wait list. And so unfortunately we are seeing a lot of students, um meeting criteria for hospitalization, but the hospitals are full. And so that speaks to the need even there. Like the children's hospitals are full. Like families are waiting in the ER for 24 to 72 hours. I've seen it go all the way up to a week sometimes. And, it's just a cycle to where families either they're hesitant to get the help, or when they do try to get the help, they're kind of like knocked down and immediately they feel defeated to where, they're back at square one, not wanting to go through that exhausting process again. And I think, sometimes again, going back to us being in the field and being surrounded with mental health all day in what we do, we're the experts. And so it's easy to think or forget that the average person is not an expert on mental health. Like the average person still struggles to even know where to begin to look for a therapist, and so that's what I'm seeing on the school end of things. And so I was just talking to my team the other day. We have a 27-page lit resource of nothing but mental health agencies, and a lot of families still don't know about it. And I'm like, yeah, we're putting it in the email, the weeklies that's going out, but how do we get it in their face? How do we get it in the community, in spaces that they're in every day? Like this is something that needs to be posted on the front door of a
Mm,
school, not in the email getting that never gets
right.
read. And so stuff like that is what my team and I are constantly, going back to the drawing board, advocating for. But this county I work for, Chesterfield County, we have 67 schools. And so for us, that's big. My hometown, Culpeper, we may have had 10 schools altogether. And so working for a county so large, there's hope, and you want to build on that. But at the same time, it does get difficult to try to stay consistent or deliver information that is accessible to every school. And so that's where we're at right now. We are planning a preventative resource fair at this time, and collaboration is key. We teamed up with another department, and they were connected to so many resources already where it was like, let's not reinvent the wheel. We've already done something similar. Let's combine our ideas. So that fair is going to be April 29th, and it's going to be right at the central office location that has big conference rooms and everything. And so we're opened it up to 50 mental health vendors to sign up to come share the information, let families receive the information firsthand, so that they can get off of waiting lists. Because although they're on waiting lists, they don't have to be. There's so many agencies right here in this area that can offer the service and meet the needs. So many people do private practice even part-time with evening availability, and that's what our students need. That is usually the barrier. If you want to work with children, the idea of you getting off at 3 o'clock and 4 o'clock is not going to cut it. They're not getting out of school until 3 o'clock and 4 o'clock. And so that evening need is there.
Mm. No, absolutely. I'm glad you brought up the collaboration and not spinning, not reinventing the wheel, like you said. And it's so needed. Like collaboration is so needed. All these different resources kind of reminds me of like Delaware. Like there's stuff out there, or a little bit stuff out there, but you don't see no commercials for it. You don't see no billboards for it. And that's something that one of the things that I had to get accustomed to when I moved from New York. New York, you wait on a bus stop and there's a billboard ad for something, or on the train or wherever, just commercials, everything's like in your face.
Hmm.
Here, like I get mad at the lieutenant governor, and it's like, is she running for governor? It's like, I ain't seen no ad, and you're running for governor yet? Like, what's going? Like,
Yeah.
like what's going on? So it's like, things like that, that we need services. I had a client that was like, "Oh, I didn't know about your clinic, and I've been living here in the area for like 12, 13 years." And I was like, where you guys always been here? Like, yeah, for at least like 10 of those years, yeah,
Yeah.
from what I've heard. So it's just things like that, and you kind of, even at my job, I was like, they were asking, "Oh, we got money that we need to spend." Or like, "Okay, how about let's do commercials and put it on TV, and like, or at least radio commercials or something to talk about, like you need to get HIV tested or whatever, like, and kind of have it put on blast so that people know where to go to get tested if they want to get tested for HIV." So it was just things like that that kind of like, the, I mean, obviously you got to have money for it, because you know everything's expensive. It goes back it goes back to money, but at the same time, people are really struggling out there. You really kind of have to like kind of think outside the box of how can you go about reaching these people.
Right. And I think that goes back to networking and collaboration, because you might not have all the money or your agency might not have all the money, but when you collaborate with somebody, I mean, typically my department, we were doing the fair, but we were doing it for the school-based support staff to get the information versus the students and families to come directly. And, we were stretching ourselves a little thin with the little money we were able to get, but collaborating with it's called the face department. Um, Collaborating with them, I mean, even the way that we are able to market this fair has just been amazing. They have marketing on Eventbrite. They were able to get 3 keynote speakers, and it's just amazing what you can do when you collaborate with other people, and then also like when you put your resources together, because somebody else might be the expert or the plug in one area, and then you might be the plug in another area. And so like we've kind of divided it where they're pushing the advertisement. They even have the news coming to the fair. We wouldn't have thought of that. And then on the other end, we have the connection to the agencies, the resources, and in the field and things like that. And so I'm excited about this one. It'll be our first student and family driven one. But again, bridging that gap so that families can come get these resources firsthand. They can connect with the agency where they can finally hear, oh, there's no wait list. We have immediate availability and openings. And I think that's going to be just a game changer for a lot of families that are in crisis who honestly they feel like they're alone sometimes. But to see all the support that's going to be out there and know that they're not alone and they don't have to continue to fight in the dark by themselves, I'm hopeful and excited for it.
Are you what are you seeing in terms of like state and local government trying to help with now? Obviously, mental health is a nationwide crisis, and on top of that, we got a housing crisis, and just there's so many crises happening all at the same time. The crisis against women, the crisis against Black women in particular. It's like never ending. Like, but in terms of mental health, like what? And I know, Virginia's a state of the Confederacy. So, but what is the state doing in terms, or if they doing anything in terms of helping the mental health crisis?
A full disclaimer, I could do a lot more um work on the macro level and following policies and things like that. But so there's work for me too, but I will say in the Richmond area in particular, you hit on a big thing as far as the homelessness crisis. And that housing crisis is indeed impacting so many people's mental health. And I assess a lot of people who are homeless, but they're coming because they are in a mental health crisis because literally they can't think, they can't sleep, they can't eat, they can't get on a stable schedule for their treatment and their routine. They can't find a stable doctor, or they might go to an appointment one time and then they lose the information, or they can't find a ride again, and so they're discharged and stuff like that, which, on the other end of that, like, there's wait lists, there's the urge to get people off of wait lists and stuff. But the housing crisis is really, really big in this area. There are a lot of individuals who don't have stable shelter, and unfortunately, it is impeding on their mental health. And so it's, how do you provide them that immediate assistance, especially when it's affecting their mental health so bad that they're having suicidal and homicidal thoughts, or it's affecting their mental health so bad that their bags are being lost, so they're losing access to their medication, they're losing access to the essentials that they would need to even be stable and independent, such as their birth certificates, their IDs, all those things. Like, losing that in the blink of an eye and overnight, that can change a lot. Sometimes I think people misjudge and they're like, go get a job or go do this, and they make it seem so easy, but you would be surprised how those basic things are hard to recover. And if you don't have the money, or if you don't have two sources of an ID,
Right.
then you can't get the one you're missing. But what about the ones who their stuff got thrown away because they left it on a corner hoping it would stay safe while they, go to try to make ends meet or go to try to feed themselves and stuff. And so what about those individuals who are literally starting from scratch, and then on top of that, you're homeless, And so the work, it really never ends. A lot of them end up in our emergency rooms simply because it's a roof over their head, it's a soda, it's a sandwich, it's a meal, and so that is what I am seeing a lot at this time as far as just mental health crisis and the need for funding. I would 100% advocate for housing funding and resources because in our area, they're building a lot of condos. They're building a lot of just new buildings and a lot of gentrification, but they're not building more shelters. They're not building more affordable housing or income-based housing. And so people are pushing into this area because we're only a short commute to the DC area and government, you think government jobs and stuff like that. And so people are pushing into this area because it is cheaper to live here versus DC and
DC,
Northern
right?
Virginia, right? And so we're building and we're building and we're building these nice, luxurious apartments and condos, but we're not meeting the need of those right here who are this is home, for them, but they don't have a home to call their own.
Welcome to the United States of America,
Right?
2024, because it's literally happening um, all over the place. See it on the news, and like back home in New York. I see it here in Delaware every day. We're literally building like townhomes and single family homes, and I'm already like on LinkedIn, with the one of the gubernatorial candidates, of like, because he actually helped build a shelter. He converted a hotel into a
Mhm.
shelter. This happened like years ago, like several years ago, and like, and so he touts about how great he did that. Okay, so we need one in like the other two counties in Delaware, and he's like, when I become governor, I'm gonna do that. They're like, all right, let's see
It's
if
like, do it again.
exactly advocate like all this money that came in during COVID. Like, it's like what did they do with all this money? Like all these
Yeah.
states got. It is,
Uh-huh. That and I would love to be a fly on the wall to again see where is the money? I can't see immediate change, but I hear we got this funding or that funding. Um, it's interesting. My heart right now, it really goes out to the homeless and then the youth. I feel like that's where I see a lot of need where it's just not meeting, we're not meeting the need at this time. And it's gonna take, more than social workers to, understand and advocate and make movement. But, that's where that collaboration piece comes in and it's just so key. And I can, like I said, I can definitely do a better job of getting into those spaces to advocate, because quite frankly, the one thing I've been saying is I'm tired of putting band-aids on wounds,
mm-hmm,
like these are bigger, deeper issues that, immediate like what happens when those short-term services end, you go right back to your main issue and then all the things that come after that you just worked on.
right.
Soon after, you're going to start experiencing those mental health symptoms right again.
Or knock on wood, with if Agent Orange wins again, there won't be any services. Period.
That hello, that part too. And so it's a lot, and then I feel like sometimes we lean heavy on our like state agencies. So we have what we call CSBs, community service boards. And so a lot of times we lean heavily on them or like we want to strict like outsource a new service and things of that nature, but we want to fund it through those bigger agencies, but they don't have the manpower. And so a lot of private agencies who offer community mental health services, a lot of them are struggling to keep up with the changes and the new
Mhm.
policies because it's like every time they get up to speed with the last one, is something else coming down the pipeline.
Mhm.
And that really hurts because these are the providers that are literally out in the field, like their work is not in an office, their work is in the field. And so they're meeting the people in need, but you got to send them to this bigger agency where they're getting frustrated, they're hopeless, because not that the agencies aren't trying to help, the community service boards, they do a lot of great things, and I'm in partnership with all three of the local ones here, but they don't have the manpower, the staffing to do it by themselves. And so that's where the private agencies are needed, and they're having a hard time being able to stay like up to date and just in what's the word I'm looking for? Not in network, but like staying up to speed with the new policies, making sure they're trained and having
Right.
access to the trainings that are now required. A big one is the mobile crisis training. I'm not sure if other states are doing mobile crisis, but mobile crisis um, is a service where you are supposed to respond to an individual who is in active crisis in the community, having active mental health crises and mental health symptoms that put them at risk, but we're still trying to divert that hospitalization, right? And
Right.
so mobile crisis is supposed to be that bridge to divert hospitalization, but also bridge and link to um, more least restrictive services such as outpatient therapy, psychiatry, things of that nature. But you have to be certified now as a mobile crisis trainer. And those trainings are full because guess who's being tagged to do them? The community service boards. And
Mhm.
they don't have the manpower to allow even a Zoom application can only allow so many people on at once. And so, trainings are being scheduled months and months out. And so what does a private agency do in the meantime until all of their staff can be certified in this new program? So there's a lot of gaps, but there are still a lot of mental health agencies that are trying to bridge the gap, do the work, meet the need, but we literally can't do it by ourselves.
Absolutely. Um, what do you do in terms of with self-care for you?
Self-care for me. Well, I'm probably Burlington's most famous customer. I spend all of my money there, I feel like. So self-care for me, it really looks like on a day where I surprisingly didn't have anything on my to-do list today, I was able to run some errands, stop by Burlington, and, just spent time in there. Usually come out with more than what I intend to come out with, but I spend a lot of time in Burlington. I love my church family as well. I go to the Life Church RVA. Shout out to them. And they have life groups where um, we meet in the community, small groups where we can just continue to support each other outside of those four walls. Um, what else do I do for self-care? That's a hard question. That's a loaded question. I've been watching Grey's Anatomy. I'm late to the game, but I've been watching Grey's Anatomy. Um, I exercise. I really do notice when I notice the difference when I exercise and when I'm not taking care of my body physically. And so exercise has been a new just outsource for me for self-care. I only work out alone typically. A lot of my friends are like, "Oh, we should do it together." No, it's my piece. It's my time where I can move at my own pace and things like that. And then getting a good night's sleep when I can. Boundaries. I would say boundaries are really my self-care. And it might sound simple, but a lot of people don't have boundaries. And
No, that's
I
true.
stick to mine. I stick to mine for the most part. If I don't feel like talking, I don't answer the phone. I structure all of my voicemails and stuff so that if somebody is in crisis, they know who to call next or what to do next if I'm not available because I'm human too, right?
Mm.
And so boundaries have been great for me. My phone goes on do not disturb sleep mode, whatever you call it, automatically at 9:15 every night. My students at Virginia State have inside jokes and they say, "Oh, Miss Whitlow, we didn't call you because we know you was asleep or you was in the bed rubbing your feet together." They say that. And so I'm like, yeah, I'm glad you know. And I hope you practice the boundaries and y'all see I live by my boundaries and I mean, they get a kick out of it. Sometimes they complain, but they know that I'm consistent nevertheless.
No, that's good. That you're right. Boundaries are it's something that I don't know. It's just I think COVID and after COVID, like the boundary, people need to like get re-educated what boundaries are. And it's a lot. People have a lot of like short fuses for stuff, and it's just it's the
And that's
communication,
because they
the
have their
lack of
work at
communication
home.
skills. And like,
Their work is right there at home with them. They don't have separation. But look, I can't even find the work phone. I don't know where it's at. This is my personal phone. It's on Do Not Disturb. I have separate work phones where I leave them on mute. I put them at the bottom of my work bag when I'm off work. Sometimes I don't even bring my work bag inside the house. If I do, it typically doesn't make it past the front door. Um, Again, because you need that separation in this field. Like, this is the helping field. There's always a need. Like, there's always somebody awake. There's always somebody who has a need, but I just believe in empowering people with resources, like directing them to the appropriate resources, a 24-hour entity where people work shifts, like I'm human. I'm not intended to stay up 24 hours and things like that. And so I'm not always going to be available. And then I always educate people of like empowering them to empower their clients and their family members and things with resources so that we can break the stigma, right? Are we really empowering if we're teaching them that they can lean and depend on us as their end all be all? No. What happens when you go into crisis? What happens when your child goes into crisis? What happens like it's not like just because we're in the field doesn't mean that we don't get hit with the crises personally, within our families, within ourselves. Like so many therapists go to therapy, so
mm,
many therapists have needs. They say we're called to the field because of something from our past, typically. Those who really have a passion for the field, that passion ignited somewhere in their development, their childhood, early adulthood. So for me, I always stress the importance of remembering you're a social worker, but you're a human too.
totally.
You're a human too. Like,
Hey,
you
you
are not
said,
a machine.
and you hit a nerve. Like I try to like empower my clients, and then there's always like a, a battle with my other you know coworkers. Like, no, you gotta like our clients need the additional hand holding, and it's like, okay, what that's gonna lead to like the burnout.
Uh, mhm.
So
Yeah,
uh,
my team, there's three of us. And so everybody knows I'm the third coworker who at 4 o'clock. You call me up 401, 9 times out of 10, you are not gonna get me. And I literally say that to them, and I'm like, physically, guys, I'm unavailable because I throw that phone elsewhere. I detach it from my body as soon as 4 o'clock hits. And so, but it's funny because I am the one like there's 3 of us. I'm a hard no. Like, if you know it's 4 o'clock, you better try one of the other two because you know Amanda is not answering. And then I have one in the middle. That's a mix of me and my other coworker. And then my other coworker, she will be getting the tea in the business at 10 o'clock at night, getting articles or emails. And I'm like, want to think about the work that's facing me tomorrow until tomorrow.
Exactly. Where can people find you?
You can find me. I am on Instagram, Concrete Roses Counseling. I am on TikTok. I just made a TikTok page. So I'm actually after this, I'm going to get into some videos, but TikTok, Concrete Roses Counseling. And then same on Facebook, Concrete Roses Counseling. I have a website, www.concreterosescounseling.com. And then you can find everything else on that website, my phone number, my email, if you have referrals. And you might just see me walking around the city somewhere, chasing somebody's kids or playing somebody's games in somebody's classroom because somebody trusted me with their kids. So here we are. That's that. But those are the places I'm at. And again, like I'm in the Richmond, Virginia area, open to networking, open to socializing, not even always networking, but self-care can look like us getting together to, normalize the work we do, celebrate it, but also decompress from it.
Yeah, absolutely. Pleasure having you on.
Thank you. Thank you.